We'll start with the first talk on health professionals' mobility in the EU, tendencies, policy issues and impact on health system by, as I mentioned, Dr. Matthias Wismar, Senior Health Policy Analyst at European Observatory on Health Systems and Policies. And we all realize, as we pointed out this morning, this is a very, very important topic.
Thank you very much. It's a great pleasure being here. I am faced with a little challenge because I was asked to talk about three important issues: the tendencies, the policy issues, and the impact. Within 10 minutes, I could talk for hours on each of the topics, but I will try to do my best, being rather brief. To this end, I have prepared a couple of key messages which I would like to bring across today. First of all, health professional mobility is here to stay. Probably counterintuitively, because you may think because of the economic and financial crisis there's a downturn. This is not the case. What we know from the data, it's rather on the increase the mobility of health professions. Second, directions and magnitude can change quickly following geopolitical and national changes, and I will take you through some of them today, through the economic and financial crisis to the accessions and other major events which have contributed to change of directions and magnitude of health professional mobility. There are asymmetries in Europe, meaning that health professionals walk into one direction or two directions. There's, of course, a long-established south-north asymmetry, but also now an east-west asymmetry. And the impacts on efficiency and equity vary from member state to member state. Okay. Let's start a little bit with the newspapers and the tabloids. It's not an expert's topic. It's really something which concerns the wider public. You've seen this. Eastern Europe is worried about losing their scientists, the brain drain. But at the same time, we have quality issues, worries about doctors coming from one country and working in another country, but not really meeting the quality standards. And even in Germany, in the tabloids, we have reports on the issue here. We have worked on this issue for a number of years, actually. We have produced 2 volumes, one with 17 country case studies on health professional mobility, and the other one was published last year. It's more a thematic study which is looking into the new rules of health professional mobility in Europe and also addressing some of the policy options. Just to give you very briefly the framework: medical, nursing, pharmacy, midwives, dentists, these are all very portable qualification in Europe because we have a joint framework for the mutual recognition of diploma, of qualification. And according to this joint framework, it only takes 3 months actually that you get registered license and registered to work in another European country. I don't go here into the detail, but it's a very useful and, from my point of view, relatively well-functioning framework. Now let's get into the data and the trends. Just to give you a bit of an overview, this is the most recent data. It was embargoed until 23rd of September. It's from the joint data collection between WHO, OECD and Eurostat. And what you can see here is the current situation of the share of foreign-trained doctors and nurses in selected European countries. And you can see that the bright green bars are the foreign doctors percentages and the dark bars are the foreign nurses. And you can see that a couple of countries are really relying quite extensively on foreign-trained doctors. Finland, Sweden, Switzerland, United Kingdom, Ireland and Norway to 20% and more actually. And if you look at the United Kingdom, it's a country with a really huge labor market, so that is quite substantial. But even then, there are quite a number of countries which rely to 10% and more on foreign doctors. Nursing figures are generally lower, but please bear into mind in absolute figures, it's of course much higher than the doctors. The data today I'm presenting you is relatively good. I have to say, 5 years ago, there was only data for a handful of countries. It was terrible data, it was outdated. This is mostly 2014, some 2013. There are still some bugs in it. Experts working on this. It's a problem that some member states are reporting differently. So, for example, nursing in Norway is not quite okay. And the Finnish doctors, our Finnish colleagues in the Public Health Institute, they say, oh, we would like to have this data because this sort of data we don't actually have. But overall, the data quality is so much better than it was years ago. Let's talk a little bit about the trends and think about the financial crisis. What was the impact? If you have here a look at this figure. It's stock growth of foreign medical doctors in Germany. It's absolute numbers of the growth. And you can see that, for example, Romanian doctors from 2010 to 2014 increased in Germany from 1,500 to 4,000. Greek doctors from 2005 from 1,500 to 3,000. So there's quite some growth actually, and it's very simple to say what's behind this. I mean, situation in those countries, in those source countries, was increasingly difficult, with a lot of budget cuts, salary cuts, cuts in perks, in social, in increases in taxes, so that it was much more interesting to come to another country, also because at the time the labor market was quite open. What does it look like in the source countries? It's Bulgaria. If you are a doctor or a nurse and you want to go another country, you need some certification, and here are figures from the certificates you issued between 2009 and 2012, and you can see that there was a growth of certificates in Bulgaria quite clearly. In Portugal the same, so more doctors in 2012 asked for certificates than the year before. Let's have a look into the United Kingdom and the nurses. These are trends in inflow, so it's not stock data, but it's inflow of nurses to the UK as measured by annual registration of EU and non-EU international nurses. The first thing which we need to see is that there are boom cycles, and then there's again kind of remission of new registrants into the system. You see that the heights was in 2001, 2002, and then it is dropping, and it's dropping because of the policy of the UK. At the time, they felt we have enough nurses actually, we have enough in the training pipeline, and we cannot fund more positions like this, and we are now in the danger that those which receive training in the United Kingdom will not find a place because we have so few incoming nurses, and therefore they stopped completely recruiting from countries outside European Union. But what you see, and this is the bright green colors, these are entrants from EU countries, and those you can actually not control. You cannot close your borders, and as you can see, EU migration became increasingly important for the UK here. Let's get into some of these changes between 2008 and now, so the impact of the financial crisis. Switzerland, that might be surprising. German health professionals are returning. In the past, plenty of health professionals from Germany went to Switzerland because of the very good working conditions there, both in the hospitals and elsewhere. And now, since the market is better in Germany, they are returning. Iceland lost temporarily most foreign health professionals. You remember they had this crisis, this currency crisis, and the currency was devaluated, and all the foreign workers looked at their salary slip and they said, oh my God, this is nothing worth anymore, I can't send anything back as remittance, so I better go home again. United Kingdom, I mentioned it, it stopped. Latvia, temporary large outflows because they had a budget cut and they were in the process of closing hospitals and wards in large numbers. And the special thing about this outflow was it was not the younger generation, it were people in their 50s which were worried about losing their jobs. Reverse trends. Spain, formerly recruited from Latin America, now is losing to Ecuador. Ireland, formerly importing, now losing. Actually, Ireland seems to recover and to recruit again. Polish health professionals, which were the first to leave and to go to the UK and Germany, Belgium and other places, are returning actually. And Germany, which used to be a country which leveled out inflows and outflows and inflows, is now a net winner. Increased outflows from Greece, Bulgaria, Romania, Hungary. What's behind? Why is that? Why is so much change happening? It's because, of course, the health budgets have been cut, and quite dramatically. If you look at some of the figures, 24% in Estonia, Latvia budget cuts 40%, Portugal 5 to 10%. But also the salaries have been cut in Portugal 5 to 10%, in Bulgaria 10 to 25%, just to give you a bit of a flavor. So the financial and economic crisis had large impacts on the status of health professionals in these countries. They still the policies in most of those countries were that they try to retain the workforce. They don't lay off people, but they needed to cut the salaries. They have extended the life working time, so retirement has been postponed, tax increases, and all this made it quite unattractive. This is a bit of an eye test, but I would like to take you a couple of years back to the accession time. This is an overview of the data which was available at the time, EU enlargement. Estonia, Hungary, Lithuania, Poland, Slovakia, Romania. The data is a bit tricky because it's intention to leave. It's the certificates that they have required by the competent authorities for going to another country. And you can see that in 2004, for example, Estonia, 238 doctors asked for a certificate, which at the time were 6.5% of the medical workforce, 6.5% of the medical workforce. That's quite something. In Hungary, 2.7, in Lithuania, 2.7. But you see that then it levels out a little bit and it was around 2%. There is an exception, which is Romania. You can see this in 2007. It's 10.2% of the medical profession has asked for a certificate. The background to this is they didn't really all leave. There was an emigration study conducted, and you can see that they counted 3% of doctors which had really left and were then practicing in another country. The background is that the medical profession was very unhappy with health policy reform in the country, and the Doctors Association, to put pressure on the government, said, let's all apply for certificates. So we put them under pressure because we vote with feet, and this will make quite some policy impact. The issue here is that, the issue is it's less than expected actually, because in the beginning people were worried about brain drain, and in Western European countries they were saying, oh my God, we'll get swamped by all these doctors and we need to find them positions and pay them all. But it's not so dramatic. The problem what they have here is that they only lose and they have no inflow. So it's one way, and that is for the long period quite some challenge for these countries. Europe is embedded, of course, in the larger global flows, and until quite recently they were important, like for example to the UK from South Africa, India, Pakistan, but also some African countries. But what we see currently is that inter-European mobility has become more important than the mobility between the regions. And in fact, neighborhood mobility is very, very important. So we see commuting health professionals between Germany, Belgium, the Netherlands, Luxembourg, Austria, Germany, Austria, Switzerland, Germany, Spain and France. We see weekend, or what we call Ryanair doctors, going from Poland for a weekend shift to the UK, and quite some colorful developments in this area. Now, just to summarize, we still have south-north movements, east-west, and especially neighborhood. And formerly, the United Kingdom and Spain had a special role. Now, let's talk very briefly about the impacts. I have tweeted a couple of minutes ago a link to a policy brief where we discussed these impacts in detail. We have tried to develop a matrix with which you can assess your own country situation. You know, what are the merits, what are the drawbacks of health professional mobilities, and we look into the EU destination and source countries. And just to give you a flavor, a couple of examples, you know, EU could be very efficient, you know, if those countries which have overproduction of doctors or nurses, you know, these can go to countries where there is a shortage, and it happens in some places. In the European country, for a destination country, recruitment from EU country, it's so much easier, cheaper and faster than from another country, and unfortunately sometimes also cheaper than producing doctors and nurses themselves. In source countries, remittances are very important, but also receiving expertise and being included in the newest development in the profession. And when it comes to equity, better access for patients, there's actually ample evidence that doctors and nurses in certain places have filled gaps which would have otherwise led to delayed treatments, to waiting lists, and probably even too low quality. And there's also equity of opportunity. So if my country doesn't offer me a lot of opportunity, the other countries may have something in stock for me, so I might go somewhere else. So this is all on the positive side, but there are also drawbacks. It's not only that we have an efficient labor market, but unfortunately sometimes it's very inefficient, and the people go from the remote and underserved areas to the overpopulated urban centers. We have international recruitment, unfortunately, as an unstable source, so you can't really manage some of this. The people go, and then after 2 years, they go somewhere else, actually. So how do you deal with this? And EU citizens are free to go anyway, so it's very difficult. And I already talked about underserved areas, and there is also an issue that sometimes the numbers are not so important, but key qualifications, key skills, like, for example, anesthesia, or what we've seen is children psychiatrists and others. So only small numbers leave, but if it's the wrong skills, the wrong people, it causes problems in the source countries. Difference in attractiveness. It's really unfair. Slovenia, after it joined the EU, they thought, we are a great country, not too bad the income, we have the mountains, we have the sea, we have everything. So we don't need to set up a new training facility, because in the past they got it from Belgrade. But nobody came. Nobody came. Wonderful country. So why is nobody coming? So some countries are more attractive than others, and that can be quite unfair, Less favorable working conditions. We see, and this is really, there's quantitative evidence for this, foreign health professionals are very often employed after their skill level, and very often they get the jobs which are unattractive, and very often they don't get training slots, actually. So this is also one problem of our labor market. And it is unfair to the professionals and patients that are staying behind, I mean, if half of the team is gone, who cares for the patients? And then a handful of carer are left, actually, that can be quite difficult. So you see, it's a quite colorful phenomenon. There are pros and cons. And what I can't present today is that the good news is there are policy options to address this. And you find them in our policy brief here on how can countries address the efficiency and equity implications of health professional mobility in Europe. And another 2 positive messages. I think the topic is actually on the European agenda. We were in 2011 with the informal council presenting results from our earlier research, and as a consequence, quite a work program was developed, and part of it is actually a joint action on health workforce planning and forecasting that is dealing with some of these issues. And the special thing is that it is working very closely with member states. That some of the member states have already started to become pilot areas, to kind of manage the workforce development, but also the flow of health professionals a little better than before. So thank you very much.